Hello everyone, it's another Tuesday on Your View. Welcome to the show. I am Murayo Afolabi Brown. As always, I have the ladies with me. YK in the building.
Yo, good morning.
Good to have you. How you doing?
I'm fine. I have no gist.
Nothing happening.
Okay, boring.
No, nothing. What can be happening inside Kulu Mata?
Yeah.
Any wise person sits down in their house. Wise, if you are wise. Or you go where there is social distancing. You know, like I took the kids out on Sunday to the park. Just
spread out.
Have fun. And then...
By the way, YK, you look hot to the capital
H. You actually do look hot.
And she has
Everything
the complete.
complete.
On her chest as a necklace.
Yes.
Someone gave me, I can't remember who gave me. And this dress was actually made in Nigeria.
Wow.
The guy that makes my t-shirts, he gave me for Christmas.
Very
you know?
lovely.
Wow.
Very
You know, he
lovely.
brought it to me and I was like, when I opened it, I said, I called him, I said, I really like that dress. Oh.
This is really nice. With the shoes, everything, you look really great.
Thank you.
How you doing, Nima?
I'm fine, oh. I'm a terrible friend. So it was my friend's birthday on Sunday, but you know what happened over the weekend?
Yeah.
Just didn't have time to be enjoying myself like that. So happy birthday, Christine Dako McHarry. She's the founder and the host of the Unveiling Africa show back in the US. She's been a sister from my town and a nice friend, and I'm sorry I missed your birthday. Happy birthday.
Happy birthday.
Many more fruitful and prosperous years to you. And then there's someone on Twitter asking me to shout out to his wife, Mrs. Joy Enato Olarinoye. She turned 40 on Sunday as well. So happy birthday, ma'am.
Happy birthday.
From
Happy
your husband.
birthday.
His name on Twitter is Lekon Ola. So happy birthday.
Okay. How you doing, Maria?
I'm fine, thank you.
Any shout outs from you?
No shout outs today, but I just need to I'm grateful to two people. They're my clients. They joined Lifestyle with Henna last year they lost some weight. They're living, healthier. I'm doing well. And then they sent me gifts. Two of them yesterday. I'm like, why?
How cool is that?
Really beautiful, beautiful gifts, really thoughtful gifts. Thank you so much for, appreciating me. I do this because really, I do this because really I just enjoy it and I like to see people's transformation, much more than business for me. So I'm happy that people are
RCCG is fasting. Right, we've started our fasting. So I'm working with her on my diet. So the idea is, though I'm fasting, we use her own meal plans as breaking. It was after I broke my fast with amala, 2 wraps, and 4 pieces of meat.
Are you allowed to eat amala?
I'm not allowed. And I remember, I'm supposed to be breaking with Miriam's plan. And I was like, oh, sugar, like, God, I can't start on Monday. Maybe I'll start on Tuesday. But it was just interesting. Yes,
today is, my mother has been dead 19 years today.
Oh.
So I wanted to give a shout out to her sister, Auntie Sonia. I hope she's watching.
How old is she now, Sonia?
Auntie Sonia is 73.
Oh, wow.
But if you see her, she looks like in her 50s.
Wow.
You
That's
know?
good. And she lives in the UK. She lives in the UK.
She lives in the She's Uncle Michael's wife. Uncle Michael that is a fan of the show.
Yes. That's cool. Nice.
Thank you.
Anything else happening?
I also got a gift yesterday, and I didn't say thank you to Dr. TG. That's how I'm a scholar, because anything else I'm dead. So thank you for my cupcakes. My children, it was Gufran's birthday. She just didn't bother, but she thought the children needed to be celebrated. And this cake maker, Most Cakery. This girl makes cake.
Wow.
I just got upset. I didn't want, but the cake were out of this world.
I'm looking for a fantastic Christmas cake. I was over the Christmas break, like a proper, not the one that they just do things.
You forgot to remind me to bring that cake. It's still in our fridge, Joe.
Like, is it Christmas cake? I don't want chocolate cake. Proper Christmas cake.
No, it's not Christmas.
Like they would have soaked the cake like almost a year.
It's not Christmas pudding.
That would have soaked it for like
Talk to her.
In the Mary, do you hear what she's saying?
Yeah.
Madam
No,
Pito.
don't worry.
She's waiting for next Christmas. She's planning for next Christmas. Well, I did not talk about my straw. You guys, I'm selling straws, so
Hey,
eco-friendly
straws.
straws. You know, especially for those of us that like to take citrus drinks, like now we're taking lemon and ginger that YK brought, and it affects
for those
your
of us
enamel.
that like cocktails.
We have second market.
Yeah, and you know, it affects your teeth sometimes. It erodes your teeth. So, and if you take coffee too, it can darken and color your teeth. So it's good to use straws. But then we know straws are plastic. They affect the environment and our planet. And in order to protect our environment, we can use these stainless steel straws.
How do you wash it though? How do you wash it though?
It comes with a brush. It comes with its own brush, so you wash it and keep it. And it comes in its own pouch. Just go on my Instagram page. You see, I have lots of them.
My grandson will go carry it, break it.
No, he will actually. He won't be able to. He won't be able to break
Well,
it.
if you see what you do to my
People are
airport.
just saying all sorts of things in this Nigeria. There's nothing you cannot fight.
Since the children, my husband has backed out of this our no
Okay,
school.
we have to
My children
run.
have not been to school since March.
We have to run.
Please, let's clap for your husband.
We have to run.
Very wise.
We haven't been.
Okay,
well.
it's Tuesday. Let's go on a break. We're just having a banter. We're not having a full discussion. Let's go on a break. We'll be right back. Stay with us. Don't go anywhere.
Stay tuned. Your View will be right back.
Right, to start with the nation. Can Islamic Council differ over cause of COVID-19 spike? Lagos or your others target religious violence, says DSS. Obiozo should work for unity. 2023, Okorocha seeks alliance of good people in APC and PDP. Resumption of schools threatens. And police arrest 47 herdsmen with guns in Oyo State.
So the DSS,
DSS, yeah.
yes, they have intelligence on, according to them, certain internationally sponsored, insurgents trying to incite religious violence across the country, starting with Lagos, Oyo, and some areas, because they will be targeting those areas and inciting inter-religious issues by what they would start up, maybe bombing or anything. That's what they suggested. But people wondered, every time the DSS gives us this update, and they sort of just cause fear without necessarily doing anything. So we'd love that, apart from giving us the intelligence, they should give us also what their plans are to curb it. What they will be doing exactly to curb it. So
I think that would be maybe much more secret because it's secret service.
Yes.
But they are also saying that maybe we should be more vigilant of things like that they are going to try to.
So I would appreciate they say
because
like
fight
this.
against each other.
They say it like this, that although we got intelligence for this, we are on top of it, and we are doing this about it, and that's ends
Okay.
it.
And
YK, another story?
Yeah, the CAN and Islamic bodies are quarreling over, because they're saying it's opening of churches and mosques that has caused the spike. The Christians are saying, no, it's not us. The Muslims are saying, we will, if you say it's us, we will close.
Okay, even though Nation, is one paper I respect, I must disagree with the headline in the Nation. So the PTF gave out real doubts, certain resolutions on how the PTF is fighting. Or how
Allegations,
is fighting.
You mean allegations that the school resumption?
No, they reeled out the cause for the spike.
Yes.
They reeled out a lot of issues, and people disagreed. So I would expect that Nation reports what the PTF said without telling us.
Okay, we'll look at what the PTF said. I think it's
sort of kind of
No. They're just saying that the PTF said this, CAN said this, the Islamic body said this.
Yeah.
The headline says, over the course, they differ. So, sort of putting two religions, obviously, two different religions. And
pitting them against each other.
Yes, it can be misleading.
It can be
misleading, yes.
But
It can be misleading.
can avoid
I
it.
agree, it can be
Because
misleading,
PTF said
totally,
a lot
because
of
this is too
other
sensitive and we shouldn't be doing that at this time. Moving on now to the Punch. Hospitals won't be able to handle serious COVID-19 cases soon, says NCDC. Police lied. Kidnappers collected 2 million naira to free us, says Ondo couple. Police probe 47 armed Fulani men arrested in Oyo State. Adoke tested positive for COVID-19, held back in UAE. 1,000 NDLE cadets stranded as minister stops Plateau orientation. Okorocha canvasses new political alliance ahead 2023 polls. And there are plots to cause religious disturbances in Lagos, Kaduna, others. Which story are we taking here?
The couple.
Oh, yes, and there was a sex romp.
couple.
Let me say the sex romp. Friends suspect drug overdose as girl dies in Yobe government lodge. Yes.
Yeah, so we remember the story of the couple. I think I took it last week, that were abducted and taken into the bush. The couple have paid 2 million to be rescued and have been let go. But they're saying that they heard reports that police rescued them. That police wasn't involved, Amotekun was not involved, no security operatives were involved. They paid their 2 million naira cash, that the abductors came and collected it from his brother on the road. He was not even afraid. He said they even stood there and counted the 2 million naira cash before they went back into the bush. So please, nobody helped them. This is what they did.
The sex
there's this girl,
she's
18. She went with the doctor. 4 of her friends took her to this doctor, and they had overnights, you know, and she died. She collapsed. The doctor went by himself to the police to report that, oh, look, this is what happened. They've arrested him and her 3 friends.
And it's important to know that this Dr. Bash also worked for the police affairs, the Ministry of Police Affairs, and he and his friends brought the girls to him, and he took one, and he slept with her overnight, and they had excessive sex. But the police are saying that there's a possible poison because she had foam coming out of her mouth. So they're trying to investigate and see what happened. Yes,
well, it wasn't his friends, it was her friends that arranged her for him. You know, so when they were trying to revive her with milk, he was videoing it. See, it's not me.
Okay.
So what
anyways, such is our story. 18-year-old, Omode.
Can you imagine?
Consensual sex is what they had.
Anyways, there's no other story in Punch. That's picture story. Nobody took that story. There was no story. We didn't see
There was no story attached.
the picture. Really was a scenes of an accident. Multiple crash at Awoyaya, Lagos Expressway.
Oh, yes. Was that in Punch?
I didn't say that. Let's move on to Daily Sun.
Yeah, it was.
DSS alleges plot to burn churches and mosques. Lasso Council ratifies Oke's appointment as acting VC. We've defeated insurgency, says Defense Headquarters, and I can put in my own words, for the 100th time. Nigerians named among 100 global outstanding nurses and midwives. FG under pressure to seek Kano's extradition. And New Year's protest, Shore gets 20 million naira bail. And FG to postpone school resumption. Okay, I have which story do you have?
Lasso, of course.
Okay, I have the defense.
I have Lasso. So we have a new acting VC in my alma mater, and he's to resume on Tuesday after voting. He emerged with the highest vote, I think 61 votes among the professors, and the governor has, appointed him as the acting VC in Lasso. But I must talk about the outgoing VC. Not only was he a professor of law, he's someone I looked up to, and I think I say it boldly here that his administration brought a lot of changes to Lasso and I'm proud of. While I was schooling there were a lot of things that displeased me. But when he became VC, and anytime I went to school, I used to just, feel proud graduating from that school. So well done, sir. Your time and tenure was one of the best, and I'm proud to be a graduate of the school.
Congratulations.
And for Nigeria.
And we won several awards as the best state university in Nigeria while he was VC also. So
congratulations.
Thank you very much. Thank you very much.
But in other words,
he has big shoes to fill, right?
Okay, so let's move on to
Nigerian ladies have been named among 100 global outstanding nurses, and by the Global Health WGH. They are Mary Agolo, Edidiong Asanga, Emanuela Itwa, and Onyinyechi Madu. I just thought we should just hail them.
Yes,
okay, let's move on to the Nigerian Tribune. 4 reasons COVID-19 is on the rise in Nigeria. 18-year-old girl sets boyfriend ablaze in Benue. Ban of passengers from Nigeria by Angola may cause diplomatic row. Plot to incite a religious crisis in Kano, Lagos, other states uncovered. And insecurity getting out of control, says Tanku Yakasai. Mariam, have a story for us?
Yes, I do. The latest ban by Angola on Nigerian travelers. So they put a ban on Nigerians coming to Angola, stopping Nigerians from coming to Angola. And the reason is because of the increased number of COVID-19 infections in Nigeria, and but people are saying that this may cause diplomatic issues between these two countries. Some people are saying that because Angola actually wanted to, there was a particular airline that they wanted to start operations in Nigeria, and Nigeria refused, so this is sort of like retaliatory. But other people are saying that it's more economic and political, that we know that Nigeria is a former colony of Great Britain, and while Angola is a former colony of Belgium. And so the UK leaving the EU. Because of Brexit, it may affect us, it will affect, and they're an oil-producing company, an oil-producing country just like Nigeria, and this may be like a conflict of interest for EU, Brexit, Belgium, Nigeria. Okay. So that's what they're saying.
Two stories quickly.
Very quickly.
I wanted to use to address domestic violence. So these two ladies, one in Benue and the other one in Akwa Ibom, decided, the one in Benue went to her boyfriend's one-room apartment, put petrol around the apartment and set it on fire, and set this young man on fire. He was rescued, but he couldn't make it. By the time he was rescued, he was, already in a very terrible state. He died at the FMC.
Was there a reason?
In Benue. So they are a couple. He died. So they're a couple, been having their issues, and she thought, I would deal with you kind of thing. So we need to address high-handedness in relationships. It is about willingness to marry or date, and the willingness to live also is guaranteed by law. And then the other one too, in Akwa Ibom, had issues with her boyfriend, brought out the machete, and just stabbed the guy several times and killed him, and tried to run away. So they caught her, beat her up, and brought her back there. But the eyewitness was saying that she was always on drugs, always with smoking the M.
We have to run, unfortunately, round of time. But there was a story that in Vanguard that Buhari is seeing what Nigerians are not seeing. Yes. That's why he cannot sack the service chiefs.
Senior Special Assistant to the President of Media and Publicity, Marilyn Garba-Shehu, has said that there are things that our president sees, especially when it comes to these service chiefs, that we, the critics and Nigerians, we cannot see. And that the service chief appointment is not a tenured one. It's not in the law. They operate on the pleasure of the president. So if the president deems it fit and he thinks that they need to stay there longer, there are some things he's very aware of that we're not. So,
okay. 200 million of you, only he can see.
Please give our president the benefit of the doubt.
Is not under some form of duress to keep them.
Oh, let's not pick up another issue.
I'm just saying, this thing that they are seeing that we cannot see. This thing that is not obvious to us.
No, of course, because of the intelligence that he has.
You don't know the kind of glasses he's using. Maybe they are very powerful.
If it would be more, we have to run, unfortunately.
To let them go.
Please, I just accept that your president can see more than you can see.
Yeah.
Simple.
That's why he's there.
Simple. That's why his glasses is special.
Oh, leave this matter alone. We'll be right back.
Those glasses are going anywhere.
Let the man.
Stay tuned. Your View will be right back.
Thanks for staying with us. So, just recently, the increase in infection across the country has marked 100,000 in terms of the infection rate, making Nigeria the 8th most infected country in Africa. Join us on the show to discuss the nation's fight against COVID-19 pandemic is the National Coordinator, Presidential Task Force on COVID-19, Dr. Sanni Aliyu. Good morning, sir. Are you there?
Good morning. So as I was saying, I just wanted to clarify that we haven't confirmed the new strain, the UK or the South African strain in Nigeria yet. We have been sending samples to Redeemers University through NCDC, but we are yet to get those results. Having said that, there's no doubt that the numbers have been increasing. We have now crossed the 100,000 mark. We have just over 1,300 deaths. And remember, we are under testing, so there is an underestimate. Even though we say we have about 100,000 cases, we know this is far, far more than that. For every one positive we get, we are missing between 7 to 10 cases. So that just gives you the idea of the extent of the transmission of the infection. And what's worrying us really is the fact that our treatment centers are now starting to get overwhelmed. Here in Abuja, for instance, we have to struggle to get places for people requiring beds for oxygen or for ventilation. It's really becoming tight. And the impact of COVID-19, the worry about COVID-19 has always been about the impact it will have on our health system. i.e. the difficulty, the challenge that people might have with ordinary diseases like malaria or severe respiratory tract infections or even typhoid, for instance, not being able to access medical care simply because the health system has been overwhelmed. So the impact in terms of mortality, in terms of death, could be quite significant indirectly, as we saw in Kano, for instance, back in April, May. What are we trying to do about these cases? Well, we've continued to do a lot of risk communication and community engagement, but at the end of the day, it all boils down to people's behavior, our risk perception. We really need to stop having mass gatherings. We need to be very sensitive to our environment and the people we meet. So, for instance, anybody I meet, I potentially consider that person to have COVID. And this is the best way to protect yourself. Make sure you wear a face mask, sanitize your hands. If you meet somebody who is not wearing a mask, please do not engage with that person. Insist that that person wears a mask before he or she comes close to you. And if you are particularly in a vulnerable group, such as the elderly, those with comorbidities like diabetes, for instance, these are the very people that the virus is after, because they are the people that are most likely to have severe illness. Based on our data, as I've been saying in the past, if you're above the age of 50 and you catch COVID in Nigeria, you have about a 1 in 5 chance of dying. Those above the age of 50, between 50 to 59, 20, between 19 to 23% of them died. And if you're above the age of 60, the statistics is even more dire. So while people might say that overall the death rate in Nigeria has remained low, but if you stratify this based on age, and you are middle-aged or 60 years or more, you are actually in a very risky situation if you catch COVID.
Okay.
Yeah, I was going to ask, because you said mass gathering and the likes is the reason for this spike. But I think I'm going to ask you this directly. I think it's the lack of government enlightenment. Because if you tell people, and I keep harping on this, if you keep telling people, if you keep drumming it into their ears, they will know. If you keep showing them, like I saw a report on TVC on Saturday, where they went into the IDH and they showed people. I watched that. I was scared. If I wanted to go for a gathering the next day, I would have said no, because I watched it and I was scared. Don't you think that the government should take it upon themselves to keep on drumming it into our ears, because we're not going to listen? If we're not enlightened, it's the same way AIDS spread in Nigeria, because nobody was telling us how bad this thing was. So, don't you think you need to adverts, not just adverts, going to the grassroots every day, every second?
So we really have done a lot of risk communication, but the problem with COVID is that it doesn't have the same shock factor as Ebola, for instance, or any of the viral hemorrhagic fevers. You don't see people dying on the street, bleeding to death, etc. And that's why people tend to feel that it's not a major problem. And then secondly, the majority of people actually remain well. You have two spectrum. You have those that have mild illness and will just have a bit of a cold, fever for a few days and then get better. And these are usually young people. And then you have the other extreme, where people become extremely breathless and end up dying. And you just don't know where you're going to be in that spectrum, because we've had elderly people having mild illness, we've had relatively young people, we've had a 37-year-old recently in Lagos who died of COVID. So that shock factor is not there. But you're very right. Those of us in the health sector, we know what we're facing, and we see it every day. We see it from telephone calls. In the last few days, we haven't been able to sleep because of the number of people coming up with COVID and wanting to have beds within the FCT. And you have to struggle and phone around, etc., to try and get places for them. But you're very right. Survivor stories are so critical. We have done survivor stories in the past, and we will continue to do that. And we will also encourage the press to help us with this, because this is a joint effort. It's a collective responsibility. It's not just about government, it's also about our community leaders, our traditional rulers, our religious leaders, all lining up to inform the public that this thing is real. And if you catch it, you don't really know where you're going to be. You could end up being well, but you could also end up being in real extremes and dying from a potentially preventable illness. Potentially preventable illness.
Dr. Aliyu, early last year when this started, even towards the end of last year, one thing we heard over and over again was the reasons why we do not have the large numbers they're recording in America and Europe is because of our very young population. But now it seems that means, from my own layman's point of view, given the number of obituaries we're seeing daily, and it cuts across all ages, what has happened to that benefit of a younger population in this in the pandemic and the spread of the virus in Nigeria?
Well, it's still affecting young people predominantly. It's affecting people between the ages of 30 to 40 years, and that data has been consistent across the board, and it affects more of men than women for whatever reason we are not sure. There's no doubt about that. But the people that are dying continue to be the elderly. We still have a few young people dying, but the majority are actually elderly. Look at the obituaries. It's mostly people 60, 65, 70, and if you probably investigate, you will find that they probably have some form of comorbidity, such as hypertension or diabetes. It's really unusual to have a young person dying of COVID, even in Nigeria. But having said this, back in April, I remember having conversations around India. And we were all marveling at how India was going to get away with COVID, very few cases, etc. What happened? In India, it all went pear-shaped. And India now has one of the highest number of cases. I think they are number 3 or so, and second highest death rates in the world. So there's no doubt that COVID prefers the elderly, it prefers the frail. It's a virus that takes opportunity of immune systems that may not be able to overcome it. Because if you catch COVID, either of two things will happen. It's either your immune system kicks in and it gets rid of it, or the virus continues to replicate within the lungs and chews away the lungs, and people go into respiratory failure. There's no drug at the moment that interrupts that replication. No drug. Whether people talk to you about vitamins or remdesivir or steroids, etc., no drug stops that replication except your body's immune system. And that's where the problem is. You just don't know whether it's going to have a party in your lungs or your body is going to react to it and get rid of it straight away. And that's why it's so critical for us. The best way to survive this pandemic is really not to catch it in the first place.
Okay, let me go on
when you go out, that everybody is infected.
Let me go on a quick break. When we come back, we'll continue this conversation with Dr. Aliyu. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we still have the chairman, Dr. Aliyu, with us from PTF, explaining to us exactly the updates on COVID-19 pandemic. Let me take a question from Nima before I ask mine. Go ahead.
So, sir, for me, one of the reasons why we have a spike is the body language of our leaders and our politically exposed people. Reason is because, aside the conspiracies that there's no COVID, most of these leaders are of the view that are making policies that are working against the fight. So we have the NIMC right now, all their centers crowded because our government chose this time to make policies that would require people to be, cramping and crowding places, public places. And while we are locking down certain other, businesses, we left this one and required that, because I don't see the reason what's, so urgent that we decided this period when we don't even have a cure, a vaccine or anything on ground to expose our people like that. So how do you see the policy that requires us to get registered or get our numbers on the, added to our NIMC numbers added to our phone numbers?
So it's interesting you say that. We've actually been linking up very closely, both with the National Identity Management Commission, NIMC, and also the Honorable Minister of Communication and Digital Economy. It's interesting you say this, but I didn't realize it until last week when I had a very long conversation with the Honorable Minister that order for NI numbers actually went out in February. And they've had people sitting down in their offices, twiddling their thumbs and waiting for people to come in and get registered. But of course, it's all our sort of last-minute rush. Here we go. The deadline is coming up soon, and that's what's causing the huge number of people congregating in their offices. We have looked at their processes. We've worked very closely with them. It's very clear if you get into their offices, it's actually pretty well organized. But the problem is outside these offices. And we will continue to engage very closely with both NIMC and communications to make sure that there are enough security people, enough staff members to make sure that the crowds are controlled outside. But definitely, what I want to say is when it comes to protocols, when it comes to health, there's nothing like a VIP. COVID-19 does not differentiate between whether you are a rich man or a poor man. It really doesn't. If it's going to kill you, it will kill you regardless of how much you have in your pockets at the time. So this is a collective responsibility. We've seen it in other countries where the leadership has sent very mixed messages. I don't want to mention the countries, but we all know those countries.
Aliyu.
And what's happened? We've had a huge number of cases.
Is there a possibility
we really
of
need
PTF?
to work together, both whether it's NIMC or it's any other government agency. Rules apply across the board. We're a presidential task force. We're a national body. We've also been linking up with the state governors. The Nigeria Governors Forum, for instance, Governor Okowa's subgroup, has been working very closely with us. We meet virtually every 2 weeks, and we go through all the issues, including what we need to tighten, what we need to relax, and how the state government can come through. But at the end of the day, we have our protocols, and if it comes to our attention, we always reach out to speak to the relevant government bodies to make sure that our protocols are respected.
So, but Dr. Aliyu, it is a fact that the protocols at the NIMC centers presently are not being obeyed anywhere. Even their strike that just got called off got another crowd yesterday. Is there a possibility the PTF would direct that registration should be put on hold and the deadline shifted even further till we are at a place where we think it's okay to try to do this? Or a different method of registration is done?
So we definitely need to work together. I know NIMC has closed some offices where they've had problems, and whenever we see these issues, whether it's online or on TV, we pick up the phone straight away and speak to the relevant authorities. We don't shirk in that regard, and they know our feelings clearly. But we'll continue to work together to make sure that wherever the risk is there, it's really dealt with straight away. And as far as our protocols are concerned, NIMC has our protocols, and I know they are trying within their office space, as I keep on saying. The problem is outside because of the crowd that keeps on gathering. And these crowds, people are supposed to be booking. That's what I understand. You're supposed to even book before you reach the office. And it's because of the rush. The time frame has also been extended. But it's not within the responsibility of PTF to say, look, you have to stop this, because at the end of the day, there were reasons behind why both NIMC and the Ministry of Communication, as well as Mr. President, feels that it's a very important exercise in terms of keeping our country safe. But it's got to be done in a COVID-safe manner.
Okay.
That is the underlying issue, and that's something that we will continue to have.
All right, so I'm told I have to go on a very short break. We'll come back and continue this conversation. Stay with us, we'll be right back.
Thank you.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we still have Dr. Aliyu with us. Dr. Aliyu, my question to you is, many experts have said that it would be wrong for Nigeria to do a full lockdown, especially because it will hurt us economically. We can't survive another lockdown, especially in the major nerve centers like Lagos, Abuja, Port Harcourt. In your view as PTF, what are your thoughts on this? I mean, especially now, this morning or yesterday, ASU was saying that they were going to have to postpone the resumption for schools. In your view, do you think we actually need a lockdown? And can we even survive another lockdown?
So just to clarify, no decision has been taken on a lockdown yet. And there's very little appetite for a lockdown, whether it's with the PTF or anybody else. We know the impact this will have on the economy. A lot of our people have to go out on a daily basis to seek their bread. But what we've been saying repeatedly is, because all of us don't want a lockdown, we need to make sure that we do not reach that stage where it becomes inevitable. If we have a situation where our hospitals are overwhelmed, our health system is breaking down, and people are dying from COVID or from other illnesses because they cannot access medical care, no responsible government will sit down and allow that situation to continue. And the only way for us to stop getting to that stage is really to respect the protocol. Wear face masks, keeping your social distance, washing your hands, and having a heightened sense of awareness of the risk of COVID-19. And that's what we're actually trying to prevent. We're trying to prevent overwhelming of the health system. And a lockdown is not going to be decided by the PTF. It's going to be decided by the behavior of the public when it comes to these rules. We have countries abroad. We have countries abroad that have very strict non-pharmaceutical intervention measures. Everybody follows it, and because of that, their economy is open. Their shops are open, their flights are coming in, their airports are busy, etc. But they don't have a COVID problem because everybody has to observe these rules. So in those instances, nobody talks about a lockdown. But we definitely don't want a lockdown. The only thing I would say is, because we don't want a lockdown, we need to make sure that we do whatever we can to prevent ourselves from reaching that stage when government has to take action. With regards to the schools, I just wanted to clarify. What the Minister of Education said yesterday was that they were going to review the date. He didn't say that they were going to change the date. He said they would review the situation and then let the nation know. So for the moment, it's still 18th January until the Ministry of Education comes back either with an alternative date or reconfirm that.
Okay, Dr. Aliyu, I just want to take us back to NIN registration and the crowds at the NIMC offices. And for me, I think what worries me or concerns me is I expected to, like a sense of outrage from the PTF. I mean, people are gathering in such large numbers, and we're hearing of medical personnel passing away due to COVID-19 infections. And it just seems that if the people at the front lines, in hospitals, at clinics, are doing their part, no one else seems to be doing their part. And I feel that government needs to be even more angry. I mean, the part of government in charge of making sure that COVID-19 guidelines are followed needs to show more anger. We also need to show, going back to also Wike's question about sensitization, it just seems to me that to say, well, just when you get there, just make sure you follow the protocol, wash your hands, wear a mask, and what's the word now? Distance, and social distance. But there's no one place that you go to that you see that it is enforced there. It is advised, it is recommended, but it is not forced on them. If it's so serious that way, that is the only way Nigerians will understand how to, if government takes it that seriously, that's the only way Nigerians will understand this is a big deal. But it just seems you can get away with not following the guidelines in one place, but you then in another place you shut down some people for not doing, like they have to suffer the consequences of other people's, bad behavior.
And to help.
So, as I said, we've been working closely with NIMC and the Ministry of Communications. The issue they are having is outside their premises, and we insist that those protocols that they have should be followed. In the first instance, people are not even supposed to go to their offices until they have booked. Once they book, I don't know whether you've been inside the office or not, but in actual fact, inside the offices, the protocols are strictly followed. People should not be presenting themselves without the necessary booking. They should follow the protocols that both NIMC and the Ministry of Communication have set up. But in terms of outrage, of course, we are not happy with the crowds that are forming outside. And we have reached out to the Minister of Communication. We've insisted that our protocols should be followed, whether in or outside the building. And they should make sure that there are enough law enforcement agents to control that. And in situations where this has happened, we've asked them to close those offices, and they have been closing them. But at the end of the day, their main responsibility, which is within their premises, they have to respect the protocol. Right. Outside their premises, they need to make sure that people are not presenting themselves in a situation which endangers them. But no doubt, of course, nobody is happy with what's going on at the moment. And whether it's in the NIMC offices or it's a party somewhere on Bar Beach or whatever, the PTF will continue to push for people to respect the protocol. Persuasion works, but we are now reaching a stage where we are tired of persuading people, and we have to go down the law enforcement side. And as you've seen, both in FCT and Lagos, we have been pushing the state government to do a lot more to put in place enforcement measures.
All right.
This is the same discussion we had back on Thursday with the state governments, and we expect that the glove needs to start coming off, really. Unless people are forced to comply with our protocol, the numbers will continue to go up.
Right.
Let me quickly ask you these two questions, because your answers are always very long. The front page of The Nation today, I saw a school that had started, they had started resumption in Oyo State, I believe. And the children were wearing masks, but their masks were not covering their noses on them. Even the teacher, his mask was covering his mouth. How are you going to ensure, if you start schools again, how are you going to ensure that the children, because they are children, they can wear the mask and then wear them on their chins or wear them on their mouths? So I see a lot of people with their masks on their chins. How are you going to ensure that people wear their masks? One. Two, people coming from abroad. Somebody complained to me that when he paid his 50,000, and when he got to the place to do his test, the test place did not exist. How are you going to ensure that these people actually get their tests done if you go to a place and the test place does not exist? Right. So his 50,000 gone, test not done.
Right, okay.
So our travel protocols are very clear. We have been trying to enforce them. It might interest you to know that in the last few weeks, we have been taking necessary steps. In the past, only about half of people even bother to go onto the portal. And of those that pay, only two-thirds actually go for the test. Our testing laboratories are very clear on the system. There are also contact details. We've also started giving passenger information leaflets now to people leaving the country, because the majority of those that leave the country do come back. So we're giving passport-size leaflets that provide information on our travel portal and what people need to do on their way back into Nigeria. And it gives people enough time to be able to go onto the portal and check. Anybody who has a problem with a laboratory test, a testing center or a sample collection center, because in some of the cities, what we have are sample collection centers. We don't have the actual laboratories. The laboratories are only in some of the states within the country. I think about 5 or 6 states. The rest are all laboratory collection centers. But nobody will pay his money and fail to have the test. If that happens, they should reach out to us immediately or check the information that's available on our portal and reach out to the lab. And if there's a problem, it will have to be addressed. They paid for the service, and we expect the private laboratories to provide.
Dr. Aliyu, we have very little time. Dr. Aliyu, you have very little time. Thank you for answering the question concerning laboratories. But there's an issue on oxygen availability across this country. What are you doing to support the states in providing enough oxygen to support those who are critically ill?
So very true. We've already asked the state governments to reopen all their treatment centers, because a lot of states have closed them simply because there isn't enough demand per se. We've also distributed, in the last few months, we've distributed a lot of what we call oxygen concentrators across the country to hospitals and medical centers. Now is the time to open those oxygen concentrators. Even the U.S. government have provided, I think, about 200 plus oxygen concentrators and ventilators, more of the concentrators than the ventilators, including training. So now is the time to bring these machines out, remove them from their packaging, and use them. From the national side, the federal government has just approved the release of funds to provide, to set up an oxygen plant in at least one in each state. And each oxygen plant will be capable of generating up to 60 cylinders of oxygen per day. We've also done an assessment of the existing oxygen plants to find out what the maintenance requirements are. The money for the FCT, for the 5 hospitals that have oxygen plants that are not functional, has already been released, and we expect them to expedite this process.
Right.
Oxygen together with steroids are the only two things that have been shown to be effective in improving outcome among patients with COVID-19.
Okay.
They are the only two things. And just to clarify, earlier on I said there's no drug that's been known to prevent replication. What I mean is to stop the replication of the virus. In terms of prevention, vaccine is still an effective option available.
Yes, so what are you doing about the vaccine? Most countries are ordering vaccines. What is Nigeria doing about the vaccine?
Nigeria is working through the Gavi as a multilateral partnership to make sure that we have vaccines available as soon as possible. It's really critical that we are not left behind. Otherwise, Nigeria could potentially end up being endemic for COVID, and nobody would want to come to Nigeria for business, and we will have issues going out as well to other parts of the world. So it's critical, as the head of the primary healthcare agency said a few days ago, they've already secured about, I think, 100,000 doses by the end of January to sort of flag off. So this is really a symbolic gesture, because the key amount, which will be 20% of the population covered, that's about 42 million persons, will come in towards the end of the first quarter, and this will be free from Gavi, but the government will need to provide money for the operational running costs. And within the same year, within 2021, government is expected to buy an additional amount of vaccines to cover 20% of the population. So by the end of the year, hopefully 40% of the population will be covered, and in 2022, an additional 30%. But what I wanted to say is the key challenge we're going to have, of course, is the acceptance of the vaccine. And primary healthcare have been working with other media agencies. There will be a lot of radio jingles, community engagement activities, volunteers, mobilizers. They will make use of the experience they've had with the polio campaign to start addressing some of the misinformation that's been out there in terms of the COVID vaccine. Okay,
we have to wrap up. Thank you so much, Dr. Ali. It's always a pleasure having you on the show. I think just
thank you for having me.
Adding a bit to what Mariam has said, maybe we'd like a PTF that is a bit more, maybe I don't want to use the word aggressive, but maybe show some demonstration of I don't want to use anger, is not the right word. That your displeasure with the crowd you're seeing. So maybe your posture must be a bit stronger than what we're saying. Maybe that will help Nigerians get the message better. Suggestion.
We really take that point, and we'll take it forward.
Thank you very much. All right, that's all we can take. You have to go. Nima, 2 seconds.
No, there's a tweet.
Okay, we have to run. All right, we're going to when we come back, we'll discuss the issue of deworming. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we're actually going to talk about deworming in children, but unfortunately our doctor is still having some connection issues. So in the meantime, we'll hear your thoughts and read some tweets on the previous segment on COVID. But in the meantime, we're still trying to get the doctor to get connected. So let's hear your some tweets.
So Emmanuel EJ says, what is the government doing about crowded markets, bus terminals? All these things make Nigerians feel COVID-19 isn't a threat here.
Okay, so why not Sinati says the government agencies need to learn to work together, because if there's a synergy between them, they won't have people clustering the NIMC centers. As important as collecting and linking mobile numbers to individuals, we must realize also the second wave is here, and the simple strategy to employ is to follow the operation standard used for visa applications. 1, train more ad hoc staff on data collection methods. 2, increase the centers of collation to open fields and name them. Open fields new. 3, let people have appointment dates after applying online for data capture. 3, let people plan. Choose nearest centers and meet their appointments.
That is in place. We read it in the papers. That's exactly in place. But Nigerians refuse to accept that in place because they would rather go there physically.
Okay. The part of the open fields, that's why I laid emphasis on that. The open field is not operating in any of the NIMC centers, particularly the one in Alausa. Now, all NIMC centers within local governments are not even operating in open fields where people can come and willingly and be able to get their data captured. They are paying The corruption within the NIMC is a fact.
Now, that's the
fact that, you know, people have to wait and are forced to get tired of waiting to pay that amount of money.
The open field is not necessary if you go according to this concept, where you apply online, you get an appointment, hang in the Nima, you get an appointment date and you go on the date of your appointment. If you go on the date of your appointment, the likelihood of a crowd is not there.
Okay, let me quickly report that as well.
Yes.
So even the application online to get an appointment date is almost impossible for some people of older ages without smartphones.
Okay.
So that thing is not a one-time solution.
So let us get to that point.
I have a friend who went to NIMC 3-4 years ago. When he tried to look for his NIMC number now, he wasn't registered. He actually went there physically.
Right.
That is one. Two, you are saying online care. People I'm telling you, people are getting trying to get COVID tests online from England and America. They come here, they don't see centers. They cannot register. Only the lucky ones are able to register to do their tests here. So online, I'm not sure it's an option.
You see, YK, the reason why I disagree with you, because I like the example this Twitter person said. He said that for just like the American visa, the poorest of the poor that has an opportunity to get an American visa will go and apply online. We'll get somebody to apply. There's a part in the application that says, get somebody to sign for you. Say that you're signing for somebody else. That's one thing. The point is that if we want to apply online, we can get an application. That's one. Number two, if indeed only those who have access can apply, let them get first. That is, sort those ones out first. Then the other people that don't have access, they will now begin to find other community outreach or how we can get them via other means.
Are you forgetting that there's a deadline?
No, of course. We can move the deadline. That one is
but these people are not even moving the deadline.
That is what we are saying.
As at this morning,
the deadline.
Senator Mamora was being reported in the paper to say that the NIMC might. So they're not even considering. It should be an immediate resolve.
I could have sworn I read it somewhere that they were considering.
They said I might considering.
Yeah.
And then they consider as at this time. And people did not go up. People are still crowding these places. Now, we can always, this is an issue of the security that we are afraid of. I personally think we should link our numbers to some form of security. But then, it is not the most important thing right now. We know we don't have enough oxygen. Our centers are using up to 300 whatever of oxygen daily, and they cannot even cater with the number of people that they have in isolation centers. Why do we want to prioritize this thing like that?
We're being hypocritical because in the same market, you say all of us go to the same market. All of us, I was in Ketu market over the weekend. Whether we like it or not, listen, I hear you. We are all against.
Why you like Ketu market? Did you wear your mask?
Absolutely. But there are people in that market that don't wear their masks. There are people that didn't have wear their masks in the market.
See what the problem is now. There are two evils.
Yeah.
You know, so the government has to make a decision. What is more important? The security. We're doing the NIN number just so that we can fight insecurity, but it's costing lives. You know what bothers me most about when we do things like that are the people who are fighting in hospitals so that we get better, and then we're endangering them. They are dying. We're endangering their families. If it's that important to us, government will stop this NIN registration until, not forever. Listen, until they find a better way to do it without causing people during a pandemic to be crowded. Okay. Talking about markets. Talking about markets.
If I stop pandemic,
so let me tell you. Let's go.
If we stop NIMC today,
yes,
and say it's postponed, we still have markets.
Good. Let me go to the market.
Yes.
See, NIN registration is not as important as eating. It's not as important as getting food. We got that one right down. The second thing is that your body language concerning other gatherings will affect how people carry themselves in the places that are important for people to go. If people have to go and get food, but they understand that everywhere else, there's a way you need to conduct yourself. When you find yourself in the market, you conduct yourself the way government expects you to conduct. If government itself is conducting itself that way and pushing and enforcing that people conduct themselves in the right way and follow proper guidelines. That's our problem. Nobody's doing the right thing anywhere. It's mostly eye service.
Thank you. If they are not enforcing, and when I say enforce, I don't mean go and beat people. I'm saying sensitization is very key. Like what TVC did over the weekend. Showing. So me, if I didn't believe, after watching that, I will quickly believe. Because I don't want to be like that. People could not breathe. People do not know what this thing is about. Sensitize them. So if you go to the market, you will see how people will now start giving themselves gap. People are wearing their mask on their nose. See, this is how people wear masks now. I see it like this.
When they are talking to you, they will still pull it down like you cannot hear them. They will pull it down or take it off. See, Murayo, it is a choice. You went to the market. I have not been to the market. I have shoppers shopping everything. Get this, get that. I'm not going to any market.
They are going to
if
market.
you are selling it, deliver it. I'm not going to any market. I've not been to market since. I've not bought anything at the market.
So the person that went for you, that want to get infected.
The person has to be in the market. The person sells in the market. So whatever you sell, I have plugs everywhere. You will deliver.
So the police thing,
we have solutions. No, it's choice. Now in this market, like YK said, I can bet you, I live in front of a major market in Lagos. Nothing is happening about sensitization in those markets. The least people that believe that there's COVID are in those markets. In those markets, you can hardly find anybody on face mask. So that's the reason I don't even want to go to the bank. I don't want to have those issues. Now, government, you're saying you are fighting. We've been begging since February. Let's see local governments. If you're sharing sanitizers, you've monetized somebody's pockets. But if you put a hand wash and running water in certain public places, people will know, when you come out for what CB by. These were done in the olden days when they had small infections. Don't talk of something as big as COVID. Till date, in public buses areas and all of that, even in the BRT buses in Lagos, they're not observing any social distancing.
Absolutely. And even the downforce.
Just forget those downforce people.
I mean, we have also heard the story of people who are traveling and buying fake COVID-19 tests.
Oh, yes.
This is happening in our country. What is happening? How can that take place?
Thank you, Mariam. Let me pause you for a quick second. So there is a part for government. There's a part for you and I. The person that's coming to take away her bros, do you have a COVID test? Yeah, I can get it for you. He is a Nigerian. He's not government. We also have a responsibility to ourselves to ensure, because that man, he's just a murderer like any other person who's been convicted, because he's offering you a free COVID, a positive COVID test at the airports. So we also have to take responsibility. So a government can make all the noise they choose to make. Negative. The government can make all the noise they choose to make. If you as a citizen don't take that responsibility, nothing's going to happen. So yes, I agree with you, but we also must talk to ourselves.
I agree with Mariam.
I agree that we must talk to ourselves. But let me tell you, I will keep on saying it. Without sensitization, I will not want to buy that test. If I'm hearing it per second, I will want to go
and find it for myself.
You see, as I'm sitting down here, I have even decided that I'm going to go and do COVID. Let me even know, so that if I go to the hospital and I'm negative, you see, you might not even see me, because I will not be hiding. As I'm negative, let me not be hiding before I become positive.
Okay.
Do you understand? Sensitize us. That's all I'm saying. The people need to be sensitized.
There's also another last one.
There are bad people everywhere.
Apart from that, let me just add to what you're saying. Apart from that, this thing is a whole process. If there's a vacuum somewhere, something will fill it. So we have people who are paying a lot of money to get their tests done. It's not happening. And you need to travel.
And
you have paid. So what do you think is going to fill that vacuum? When people are paying, they know they cannot get, they have to travel.
Miriam,
so that's the thing. If you do not follow the right...
One of the highest secured place in the country are the airports. How does someone sell that, even if it's whispering?
Everybody's coming.
No, even if it's whispering. And every security agent, the custom, all of them, they turn their back and they allow it to happen.
Yes, they're complicit.
So, see, we love this. I felt, see, you know how hot I felt? In my streets, my wahala on this COVID thing was the highest. You don't wash your hands, please don't. I remember talking to my neighbor saying, sorry, I'm not taking visitors. And that man stood in front of my door with his son. And I refused to allow them in. And my mother visited and I did the same thing. And I didn't visit my parents because I thought, I'm working, I might be carrying whatever to them. And then, COVID, I got tested positive to COVID. Then people who are the ones laughing and saying, they will come and say, where's your bucket now? They make a joke of it. Our government and the people in power are the ones making a joke of it the most. Yeah. When it's convenient, they receive their friends and visitors, they threw their Christmas parties, they did all of that.
A couple of months ago, I went to a wedding. The church, if you see how full the church was, full, I was shocked. About 10 people were once, I just went to go and sit on the stairs. What?
No, but they had a space open.
Which space?
There's always social distancing. In my own church, there's social distancing.
Did you go to a wedding?
I'm not lying.
What's the church?
Like this. And
did you go to that wedding? YK?
I had to go and sit on the stairs because there was no way I was going to sit on any chair in that place. And all I could think of was, what? They say we should social distance.
Nobody cares.
You know, but you will be blaming. Well, look at all those nightclubs that have been opening, and then you see all of them crowded inside. Are they normal? They cannot be normal. If they are normal, do they want to get sick? One girl said they put her inside Black Maria, and inside Black Maria she got positive. She now caught COVID. I said you didn't catch it in the nightclub where you were.
In the Black Maria.
Inside the Black Maria.
He was waiting for her in the Black Maria to get it.
If it's you, if it is you, where will you say you got it? Is it the place that you went with your leg? I'll be the place they force you. It's the place they force you because even they are not even separating or social distancing anybody in the Black Maria. In our prisons now, how are we? What are we doing? Well, see, let's just leave this lip service.
Oh, listen.
No, let us see. You church people, you that are doing redeeming fasting. Yeah. Let me tell you, just every morning, just do a service and
we are praying for you people. We are praying for Nigeria.
That's Nigerians. We will recover, and this thing will not.
Don't worry.
It's prayer.
That's all. We are on a 63-day fasting.
There's a video.
And part of our prayer is for Nigeria. Don't worry. This is not part.
Maybe all your prayers should be for Nigeria.
There's a video of a man of God, who is making fun of people that wear masks. If you call yourself a Christian, call yourself a man of God, and you're wearing masks. This is in church with congregation there. So these are the sort of people who, if government is doing one thing, we're learning about guidelines. You go to church on a Sunday and then you're told it.
You see, another thing is that we don't believe, Nigerians, we don't really believe in this COVID.
Yes.
We do. We don't. The tweets we have are very minimal today. If we were talking,
let's take tweets.
This husband with that one's husband.
DNA.
You see the tweets.
No, let's take tweets. We have tweets.
We have tweets. I'm not saying, but I'm saying that we will have thousands of tweets. Yes, if it was DNA or somebody's husband or somebody's wife. Because a lot of people are watching and saying, these women, they are talking, their government has paid them. Government hasn't paid me.
At all. Nobody.
Me? I'm just afraid for my life.
They said
and everybody else's life.
They paid me to test positive and my husband to test positive and go through what I went through. Let me know
so we should please. That's what I'm saying. Even on this show, even if it's our banter every morning, we should talk about it.
Yes, now.
So that it's part of our own duty to sensitize people so that Nigeria doesn't fall.
Yes. So President says it's simple. NIMC extends deadline to 1 year for markets and put task force in place. What they will do is, if you're seen without the face mask, tell them to wear it. In transport, where transport road safety should also be on the road to enforce that. And churches close down churches without protocols. Those that don't have protocols.
Why not systematic? Collection of data is a continuous process. You can even allow specific registration areas for people older than 60. Let there be continuous sensitization campaigns. All this can be managed. We do for visas, antenatal, and
That's
so
my
on.
friend.
Olusegun says the yellow downfall buses in Lagos are not observing social distancing at all. And the painful thing is that they still charge 200 naira to 400 naira for a short distance, and they carry 4 per row. So government is serious.
We also, even on our show, we had actually doing our own show. We used to have 3 of us, and that's what we are likely to go back to that 3 because of this issue of COVID-19. Just to ensure that we adhere to the social distancing in our conversations on the show, because I know we're getting tweets and saying that, oh, you guys are talking about COVID-19, but you yourself are not social distancing. Yes, during COVID, we actually are social distancing. We had only 3 of us on the set, and we're going to probably go back to that shortly. That's what we can do.
We are still in COVID.
We're still in COVID. Where we had that. These are things we are going to put together. But we also all have our face masks on, and we take it off just for the show. That's all we can take on the show. We'll see you tomorrow. Bye for now.